Hello everyone, welcome to my 6-month progress report. I would like to present my PhD thesis, which is microbiome modulation in chronic inflammatory skin diseases. My name is Gabriella Mohos. I'm a medical doctor and a PhD student in the Department of Dermatology, Semmelweis University. And our vision is to provide a better care for patients with chronic inflammatory skin diseases with a mission implementing the microbiome modulation in chronic inflammatory skin diseases. I have two ongoing projects. The first one is about the microbiome modulation in atopic dermatitis patients, and the second is about the topical calcineurin inhibitors. Moving on to my first project, which is investigating the effect and safety of microbiome modulation in atopic dermatitis patients with a systematic review and a meta-analysis. Atopic dermatitis is a chronic inflammatory skin condition affecting 20% of children and 3% in adults. It has a decrease in quality of life and has a physical, emotional, and social impact. A severe atopic dermatitis patient suffering from quality impairments, depression prevalence is more than 30%, is experiencing suicidal thoughts or has a stigma or isolation. Meanwhile, the gold standard treatments are moisturizer, topical steroids, and systemic immunosuppressants. They usually come with side effects like skin atrophy or an increased risk of infection. We already know microbiome has a major impact on atopic dermatitis, so microbiome modulation would be a safer and novel therapy treatment. So our aim is to evaluate the efficacy and safety of microbiome modulation in atopic dermatitis. The question would be, is microbiome modulation effective and safe in the treatment of atopic dermatitis? To answer this question, we have the PICO framework. P represents the atopic dermatitis patient in an intervention with the microbiome modulation, including the probiotics, prebiotics, symbiotics, postbiotics, or the antibiotics, compared to placebo or the standard treatment, with an outcome of the disease activity and the secondary outcome, the quality of life, the depression score, itch scale, or the adverse effects. So we hypothesize microbiome modulation is effective and safe in the treatment of atopic dermatitis. And if that's true, that we can implement in the clinical or research field, so patients with atopic dermatitis would have a better quality of life and a controlled disease activity, and we could offer a safer and alternative treatment. So for our search key, I use the first domain as the atopic dermatitis and the second domain as the microbiome modulation. And we were conducted in 3 databases. I found with this search key 6 key articles. I wouldn't go in details, but basically the main point was they were using usually probiotics in the intervention, and the score ad was usually the same. It's a decrease in this score system. The flowchart of my selection, first I had almost 12,000 hits and reduced after the title abstract selection and the full text selection. It became 102 eligible full text, and after the citation chaser, then we could add 7 more articles. So we are basically now at the data extraction phases, and we are in the progress. Jumping to my second project is investigating the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases with an international survey. So immune-mediated skin diseases like atopic dermatitis or psoriasis or the seborrheic dermatitis. I also mentioned that atopic dermatitis is a chronic inflammatory condition with itching, and meanwhile the first-line treatment is corticosteroids. It comes with side effects, but they use most widely. More than 70% of the patients using corticosteroids. So calcineurin inhibitors could offer an alternative treatment. Calcineurin inhibitors are immunosuppressants, and they are the second-line topical treatment of atopic dermatitis, but only 10% of the patients using it. It has 2 main active ingredients, the tacrolimus and the pimecrolimus, and usually used off-label. So meanwhile, they come with benefits because they can use on sensitive areas of the skin, like on the eyelids, and not causing atrophy. They come with challenges, like photosensitivity, or burning sensation, causing compliance issues, and it's a theoretical but unproven increased risk of skin cancer. So that's why the effectiveness needs to be more explored. So our aim is to evaluate the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases. So the question would be, are calcineurin inhibitors effective and safe in the treatment of immune-mediated skin condition? To answer this question, we have the PEO framework. PEO represents the immune-mediated skin conditions patient exposing with the topical calcineurin inhibitors, and the outcome would be the changes of the disease activity and the adverse events and the compliance. So we hypothesize topical calcineurin inhibitors are effective and safe in the treatment of immune-mediated skin disease. And if that's right, then the clinical implication would be an extensive use of the calcineurin inhibitors in immune-mediated skin diseases, so we could offer a safer and novel therapy. For our survey, we collect data from the experts and the patients also. And we are collecting the treatment effectiveness. I would like to highlight some of our questions on the quality of life, the treatment duration, or the alternative treatment option, the concern about the treatment, or the follow-ups. So in summary, I would like to submit my first project until September this year, and my second project next year, May. I would like to end my presentation with a quote from Lao Tzu: "The journey of 1,000 miles begins one step." Thank you for your kind attention.
How can you apply these microbiome modulation agents topically, systematically, and would it be an add-on therapy, for example, next to steroids?
Mm-hmm. Thank you for your question. In my research, then we are using topical and systemic probiotics, for example, using capsules, or you can use with moisturizer and use with the corticosteroids. So there are add-on therapy also.
Thank you for your presentation. I really enjoyed it because my own topic is related to probiotics, but I investigate them related to oral health and caries development, which is pretty different. But I'm really curious, as you read the papers, for how long do patients consume probiotics?
Thank you for your question. There were different papers about this, but usually the standard weeks was 12 or 16 weeks, and there was a follow-up after this maybe 12 weeks. They follow up later, 6 weeks later.
And I have another question. I know it's too early to ask, but can you predict anything about the results based on the articles that you read?
Yes, it will be a little bit early to predict, but I'm at the data extraction phase, so I see that there are differences in these articles. There are some articles about decreasing in scorat, which is good, we want this in this atopic dermatitis, and there are papers which not a significant change in the disease. It depends. I think there are heterogeneity in the patients. There are infants and adults, and they're using different probiotics, so including different bacterium.
I would like to ask you if you faced any challenges during the data extraction phase.
Thank you for your question. Yeah, basically the main challenges was the heterogeneity, because there are papers which investigate only the infants or the children, the adolescents or the adults, and the heterogeneity in the microbiome modulating agents. There was there was no same product what they use in the microbiome modulation.
Are there any safety concerns regarding or adverse events regarding microbiome modulation?
There were some articles about, for example, children who cannot finish the research because there were some adverse events, for example, vomiting or nauseous. But basically, that's what it says.
Okay, thank you. And how do these studies control for other factors, such as diet, that might affect the microbiome?
Yeah, so in the research, the patient had to exclude these fermented foods, for example, yogurt, because it could affect in the research.